I started to feel pain in the right hip. Because of waiting lists, I paid privately to have an MRI scan which revealed the extent of the very severe hip degeneration. But it became very clear that although I was defined as urgent, that would bring me down the waiting list from 30 months to about 6 to 12 months. I found Elite Surgery abroad, began to look at them on the web, and it seemed clear to me that the overall package that Elite Surgery offered was potentially infinitely better than anything else I'd encountered. I have the operation on a Monday, which by all accounts goes very well. I have a full anaesthetic and come round about 3 or 4 hours later. Briefly saw Dr. Monsieur then, who said he was very happy with how it had all gone. But almost immediately you can recognise it's a different kind of pain. It's not the kind of pain that was emerging from the arthritic hip. But of course the hospital is incredibly on it. And the next morning I met the first physio who took me for a little walk, a little shuffle along the corridor. And I go back to the apartment. And then I met Benoit, a delightful fellow, who took me down to what they called a gym. Physio begins to put me through my paces, gives me some particular exercises, and he upped the demands on what I had to do to move the leg around. The apartment is simple, but it has everything, had everything we needed. And so at the end of the 17 days, we flew back. I was immediately hooked up with Dr. Edmund, who has seen me 2 or 3 times, 4 times, I think, just to check how the wound was repairing. And now, over the space of the last 3 or 4 weeks, I've got rid of both crutches. Not completely without pain, but almost without pain. And it's just a fantastic situation to be in. I'm full of praise for this operation that Raoul has set up, and the care and attention and level of detail that is offered in the whole package.